Hello and welcome back. In this chapter, we're going to be discussing bipolar disorders. And it's really important that when we talk about bipolar disorders, you have an understanding of the different levels of it, okay? Where I want you to look at it as from a mild, moderate to severe um, hierarchy, okay? Well, the psychothymic disorders are going to be the more mild disorders. The bipolar 2 disorders are going to be the moderate level, and bipolar 1 is going to be the severe disorder. So I want you to look at it from that spectrum, right? And we also have the substance and medication induced bipolar related disorder, and we have the bipolar related disorder due to another medical condition, or other specified bipolar related disorders, or unspecified bipolar and related disorders, right? All of these disorders are characterized by intense alternating episodes of mania and depression that go far beyond normal mood swings, right? So when we talk about bipolar disorders, we're talking about characteristic features of bipolar disorders is the tendency for an individual to experience manic or hypomanic episodes alternated with major depressive episodes. So mania is a distinct period during which predominant mood is either elevated, expansive, or irritable, or increased activity or energy with several associated symptoms, which like inflated self-esteem, decreased need for sleep, pressured speech, racing thoughts, distractibility, hyperactivity, agitation, or excessive involvement in potentially dangerous activities. So if someone is manic in a manic episode, they're going to be highly escalated and they're going to be like on the go, rapidly on the go to the point where they can't stop whatever their interest may be or whatever they do or whatnot. Those behaviors are going to become potentially dangerous as the activity they wouldn't sleep. They couldn't concentrate on anything else. They'll be hyper focused on that area. They can actually have a lot of dysfunction in their life because of their level of mania. Overall, the mood disturbance is less severe in hypomanic episodes. And the difference is in a hypomanic episode, you may have elevated mood or whatnot, but it's not going to last as long. We're talking about 4 days, around 3 to 4 days of mania, where a manic episode is probably going to be about 7 days or more, right? And it's going to also be less severity with those hypomanic episodes. So, variations of bipolar disorder. A first episode might be either depressive or manic. The presenting pattern about bipolar disorder is unpredictable, or subsequent episodes, if they occur, remain variable. Consider the bipolar disorders as a spectrum. Individuals can be present with a range of symptoms from mild to moderate to severe, as I just stated. So let's talk about bipolar 1 disorder. This refers to severe manic episodes accompanied by one or more periods of major depressive episodes. Right? The person must show at least 3 symptoms of mania, or 4 if the mood is irritable, that lasts for more than 1 week. So more than 1 week, more than 7 days. The symptoms are considered from a list of 7 symptoms, including inflated self-esteem, decreased need for sleep, more talkative than usual, flight of ideas, distractibility, and increased goal-directed activity or psychomotor activity, excessive involvement in activities that have high potential for painful consequences, such as unrestrained buying sprees, and a total of 5 symptoms are required for major depressive disorder. Either symptoms of depressed mood or loss of interest and pleasure, and also look unusual changes in appetite or sleep, significant decreased energy levels or fatigue, feelings of worthlessness, difficulty concentrating, and suicidal thoughts. Bipolar 2 disorder, again on that spectrum, this is going to be more moderate. Refers to the same pattern of symptoms, but the major distinction is in the degree of severity. Typical these disorder does not lead to psychotic behavior or require hospitalization. They're characterized by one or more depressive episodes with at least one hypomanic episode that generally lasts approximately 4 days. Similar to bipolar 1, it also requires 3 or 4 symptoms with those with irritable mood from the 7 characteristic symptoms required that we just discussed. So specifiers for bipolar disorder. You have anxious distress, mixed features, rapid cycling, melancholic features, atypical features, psychotic features, catatonia, peripartum onset, and seasonal patterns. Psychothymic disorder refers to a chronic or cyclic mood disturbance that has many of the same features found in major depressive episodes and considered a milder form of bipolar 2 disorder. This pattern must last for at least 2-year period and an individual is not free of its specific manifestations for more than 2 months. Symptomatic features of mood swings typically alternate in an irregular fashion, lasting for days or weeks. The related bipolar disorders are substance/medication-induced bipolar or related disorder, which is characterized by elevated or expansive mood that may not be that may or may be not be evidence of depressive mood episode. And symptoms of bipolar disorder have occurred during substance intoxication or withdrawal, or after the exposure of medication. Next, we have bipolar related disorder due to another medical condition. This is considered if the manic or hypomanic or mixed symptoms occur directly pathophysiological result of another medical condition. Other specified bipolar related disorder is a sign when full criteria of any bipolar disorder have not been met, but there is a current level of dysfunction due to the symptoms that the client does have. And then we have finally unspecified bipolar related disorder. This is when there's insufficient information may be available to support a diagnosis, and the practitioner chooses not to specify the reason the criteria was not met. So with the change from 4 to 5, what we got was a new specifier with mixed features was added. When a person does not meet full criteria of any of the disorders, the bipolar related disorders diagnostic class, it allows for other specified disorders. And anxiety symptoms are included as a specifier to highlight anxiety that is not a part of the bipolar diagnostic criteria.